Hello, I am Jorge Cortes, and I would like to invite you to join me once again at the 25th Annual International Congress of Hematologic Malignancies on February 25th to 28th. Throughout this virtual interactive conference, you will have the opportunity to participate in a series of didactic discussions featuring a wide range of the most relevant topics in hematologic malignancies. Gain insights on topics such as how to apply new approved agents in hematologic malignancies, the latest development in CAR T cell therapy, and much more. Learn more about this program at the Physicians Education Research website, and I hope to see you there. Well, as we always do, we have a great program, very comprehensive in all things related to hematologic malignancies. As we've done in several years now in a row, we start on Thursday with a CAR T symposium, and that's a fantastic symposium usually. So I'm really looking forward to what we're going to be seeing here because we always get some of the newest, and there's a nice mix between what's coming next, the most up-to-date research, as well as practical advice on now that we're using these cells commercially and in practice, some practical advice on best uses and how to manage the daily operation of these cells. So I'm really looking forward to this year's symposium on the CAR T cells. I'm also very interested in a section that we have now on how telemedicine and COVID and all these things are changing how we practice. I think we have a very nice lineup there of different topics that are very current now because of how all of these situation that we're living is changing the way we practice. As always, we have a lot of very practical conferences on how I manage these and how I approach these, given by top experts. These are always very useful. I use them a lot, so I'm really looking forward to these presentations, and perhaps some of my favorites are these the crossfire where we have all the panel discussing topics and sometimes agreeing and sometimes not, and through these disagreements you learn a lot about the pros and cons of different approaches and how people see different things. Perhaps the most important is to be an active participant. I think the discussion is very valuable, and of course all the presenters are very happy to take questions, and the more questions we get from the audience, the better, because again we do want to make these practical, to influence what we do. And at the pace that the discoveries and the new drugs and everything happen, I think that trying to learn more from these experts, there's only so much you can cover in the presentation itself. So the questions and answers are very important. Um, and of course, I think that one thing that I've enjoyed is to participate in sections of areas that I don't really treat as much. As you know, I'm more into leukemia, but I really enjoy listening to our myeloma colleagues and our lymphoma colleagues because I learned so much, and there is much less division of diseases nowadays. What happens in one disease spills over to the other one, and then of course most of us or most of the attendees have to deal with everything. So we have a wide range of topics. So it's very important to I think that as much as possible to really attend the whole conference, even the non-CME activities. They're some of these have been very high level, very valuable in practical terms. I think one of the important things about this conference is that it gets us out of our comfort zone. We all practice based on our experience, on what we read, how we interpreted the literature and the findings in the conferences, etc. But hearing other people, how they approach it and how they manage things, perhaps very different than what we do, and being open to perhaps looking at other ways of doing these things is very valuable. So um, uh, that's been of great use to my practice to CG. I mean, I think I know these things, but Dr. So and so just mentioned how they do these and how they practice. So I've used a lot of that information and those practical conferences, how I treat these and how I approach that. I've used a lot of that information in my practice, and certainly yes, it definitely helps improve my patient outcomes because then I get the benefit of other views from other people, and it enriches the way you think rather than just getting into your own way of thinking. No matter how much of an expert you may think you are in a given area, or how many patients you've treated with that, always the experience of others and how they see things can help you improve your practice and with that improve the outcome of your patients.